But one thing I tell all my pickleball players to take to help their knee pain and keep the knee from having aches and pains when they're getting injured, they need an anti-inflammatory and they need antioxidants and micronutrients to allow the body to repair. So the Joint Health Multi is great because it's got curcumin along with piperine and PEA, which is a natural painkiller. You actually make it in your body. You're making it right now. We just don't make enough of it all the time. And then ginger, which has been studied a lot against arthritis and has been highly successful. Ginger's actually great for your digestive system too, by the way. And it's a good palate cleanser. That's why they give you pickled ginger with your sushi. Tart cherry extract, amazing for pain control. It functions in kind of a similar way as ibuprofen does. It turns off the COX-1 and 2 enzymes. Also turns down the NFKB gene translocation factor. So that's, transcription factor. The NFKB, nuclear factor kappa beta, goes into the nucleus and turns it on to induce inflammation. So if you can block that, you kind of block inflammation at the source. So most natural medicines do that, most synthetic medicines do not. So tart cherry extract's awesome for pain control, antioxidant, to allow your body to repair overnight while you're sleeping, great. Glycine is an amino acid that is every third position in the collagen bundle. What is connective tissue? The Achilles tendon, the knee, all of that. Connective tissue is just collagen, type 1 or type 2 collagen. Collagen is protein. It's just 3 amino acids that are linked together in a string, and then there are 3 of these strings that wind around each other, and they're connected to each other with crosslinks, and the number 1 cofactor needed to make the crosslinks is vitamin C. So glycine, every third position in collagen bundle, very important for connective tissue. I get all my patients to take fish oil of some sort, omega-3, particularly if it's higher in DHA, which is great for the brain, which is going to help you with your balance and agility, right? But omega-3 is highly anti-inflammatory. We've talked about this in other talks before. If you can fill your cell membranes with omega-3s instead of omega-6s, then your body has the building blocks for a more anti-inflammatory pathway versus inflammatory. Either way, when it senses inflammation or injury or a pathogen, it's going to pull building blocks out of the cell membrane, pass it down the inflammatory arachidonic acid pathway. And if you have a lot of omega-6 oils that are in your cell membranes, which is what you find in seed oils and things like that, then that preferentially goes down a very pro-inflammatory pathway. If you have instead some omega-3s, it doesn't have to be even all omega-3s, just some, in your cell membranes, you have enough to go down an anti-inflammatory pathway. You're still able to repair, you're still able to fight the pathogens, but you don't attack yourself as much. Omega-3s are hugely anti-inflammatory, and they increase flexibility of the cell membranes, which in turn makes you more flexible. The connective tissue multi has everything you need to heal and repair, which is going to be your calcium, magnesium, vitamin D, your vitamin C, very important, not just as an antioxidant to support your immune system, but also to help the collagen cross-link during your repair cycles. And then of course, things like the focus and the energy, which have a lot of beta glycans and other products that help with brain health, and neurotropism, which means helping reform or help regenerate or repair brain cells. Why is that important? Because if you don't have a good brain-body connection, you can't have good balance and you can't have control over your body and be a really good pickleball player. And then of course we have an arthritis gummy that just has like frankincense, PEA, and things like that to help you reduce pain and inflammation from any given tendonitis. All this is great, but remember these are supplements, which means they're supplementing what you should be doing, which means you should be exercising and eating well, and most importantly, sleeping. If you're playing pickleball, you're already getting your social connection in your exercise, right? I've told you a few exercises you could do to make your play better, but you also need to be doing the heavy sleep every night.